Life is about relationships. Whether we are a patient, nurse, caregiver, or community leader, we interact with people every day. Each interaction, both positive or negative, influences how we build new relationships, engage with others, and make decisions that can influence our health and the health of those in our communities. Unfortunately, in health systems around the world, relationships are strained. Many patients feel their concerns are not heard or addressed, and many health workers feel overwhelmed, under-resourced, and blamed for poor quality care. Instead of respect and compassion between patients and health workers, there is tension and barriers. Improving these relationships through intentional community engagement is essential to supporting people-centered services that prevent ill health and promote well-being. Research shows there is a strong link between human connection and health. People who have strong social connections and feel they are well connected to others live longer and recover faster from disease. In fact, every interaction between people releases a mixture of chemicals and hormones that can either be harmful or health promoting. When people have positive engagements, they are contagious. We share in smiles and joy with others. Every day, there are millions of interactions, big and small, in the health system. A nurse discussing a case with a doctor, a caregiver raising a medication concern to a pharmacist, a receptionist taking an urgent call from a parent. That's millions of opportunities to make even a tiny difference. What if clinicians stopped talking at patients and started talking with them? What if managers empowered their staff by cultivating team cultures focused on safety and professional growth? What if policymakers listened to service providers and users so they understood where to invest resources to build healthier and more equitable communities? Every single form of engagement between people, no matter how brief, is an opportunity to meaningfully connect, to plant seeds of compassion, and to build trust with one another. It starts with listening, empathizing, and working together to develop the best solutions in each circumstance. Through intentional community engagement, patients can become active champions for their health and the health of their communities. Staff can take initiative and lead change in the health system. Together, everyone's health and well-being can improve. Science and personal experience tell us that the way we interact with each other affects our health and well-being. Every interaction carries an opportunity to build positive relationships, which in turn builds trust, leads to more effective partnerships, locally relevant solutions, and wiser use of resources. Let's build meaningful relationships in every interaction through community engagement.
Hi, my name is Carrie Andrioletti, and I'm a professor of psychology from Central Connecticut State University. And I'd like to talk to you today about community engagement. So welcome to this Aging Mastery Program video on community engagement. So there are many ways to define community engagement. Often the first thing that comes to mind is something like volunteering at your local library or at a school, but there's also other types of community engagement. Picking up litter in your local park. It could be even helping your neighbor, bringing in her mail or feeding her cat, getting involved in town politics, even running for town council is a way to be involved. You don't have to be physically going out in the community to be involved in your community. There's lots of opportunities for making phone calls from your home or getting involved in citizen science projects on the internet. Research shows that community engagement is really an important part of successful aging. It gives people purpose and meaning, which is very important for our well-being. It helps to build our social networks, which is also very important for our well-being across the lifespan. Research shows that it makes people healthier. If you're busy engaging with your community, then it helps to prevent social isolation. People tend to be more physically active, take better care of themselves. So not only are you doing good for the community, but you're also doing good for yourself to be involved. If you're new to a town and you're thinking about how are you going to get involved in your community, start by going to your town website. Usually they have a tab for volunteer opportunities, or contact your local senior center and find out what kind of opportunities they have there. Some universities offer classes for free. If you're a certain age or older, you might be able to be a mentor to college students or volunteer in your local school system. Just don't be afraid to make that phone call. And if there's something that you're passionate about, if you love animals, call up your local animal shelter and see if they need volunteers. Or if you love reading, contact your local library and see what kind of opportunities they might have for volunteering. One really important part of community engagement is that you need to do something that you feel is important to you, that you value, and that's going to make your engagement even better for you. So it's not about you just have to do something to keep busy, but it's about finding things that you're passionate about, that you're interested in, focusing on your strengths and what you have to offer. Community engagement doesn't have to be big. It can start really small, and it can be as simple as letting someone go first in line at the grocery store, or bringing in your neighbor's newspaper, or planting a flower, or giving some flowers to your neighbor. I mean, these really small things. We know that positive emotion and positive connection, even in very small doses, really can make us feel better. Try a random act of kindness. Community engagement is also really important for a sense of purpose and meaning in life. And research shows that for people who have a sense of purpose and who are engaged with their communities have higher levels of well-being and a lower incidence of depression. They tend to take better care of themselves. So it's important to find something that you feel really good about doing and, go and do it. I hope you've enjoyed this Aging Mastery Program video on community engagement. I hope you've learned something, and I hope I've encouraged you to get out there and get engaged.